6 types of addiction explained. We start with alcohol addiction. Over 3 million deaths worldwide each year result from harmful alcohol consumption according to the World Health Organization. Alcohol acts on GABA brain receptors to slow down central nervous system signals artificially. Chronic heavy drinking reduces natural GABA neurotransmitter production by 40%. The brain becomes physically unable to calm itself without alcohol in the bloodstream. Severe withdrawal triggers tremors, rapid heart rates above 120 beats per minute, and dangerous seizures known medically as delirium tremens. Liver cirrhosis damages functional tissue in 20% of long-term heavy drinkers, causing permanent organ scarring and fluid retention. Medical detox programs combined with behavioral therapy help 50% of recovering alcoholics maintain long-term sobriety. Next up, nicotine addiction. Nicotine reaches the human brain within 10 seconds of inhalation, releasing sudden surges of dopamine into pleasure pathways. Tobacco smoke and vaping liquids contain over 7,000 chemicals, including 70 known human carcinogens like formaldehyde and benzene. Smokers experience nicotine cravings every 2 to 3 hours as dopamine levels crash rapidly below normal baseline. Arteries narrow by 25% immediately after smoking a single cigarette, increasing long-term heart attack risks by double. Nicotine replacement patches and gum increase successful quitting rates by 60% compared to unassisted attempts. Now, opioid addiction. Opioid painkiller prescriptions spiked in 1996, triggering an epidemic that has claimed over 600,000 lives across North America. Opioids bind directly to Mu-Opioid brain receptors, blocking pain signals while flooding brain pathways with 10 times normal dopamine levels. Tolerance develops within 14 days of continuous use, requiring higher dosages to achieve the same pain relief or euphoric state. Overdoses slow breathing rates down below 6 breaths per minute, causing severe oxygen deprivation within 5 minutes. Emergency nasal sprays like Naloxone reverse active opioid overdoses in under 3 minutes by knocking opioids off brain receptors. Let's proceed to gambling addiction. Gambling addiction triggers the exact same neural brain pathways as substance addiction, affecting 10 million adults in the United States. Slot machines and betting apps use variable reward schedules to keep dopamine spiking on unpredictable random payout wins. A person with severe gambling disorder loses an average of $30,000 in personal debt trying to win back lost money. Brain scans reveal dopamine spikes occur during near-miss losses almost identically to actual jackpot wins. Blocking betting apps and attending support groups help 65% of problem gamblers regain financial stability within 1 year. And then digital addiction. Smartphone users' touchscreen displays an average of 2,617 times per day, driven by rapid social media notification reward loops. Short-form video algorithms deliver instant dopamine hits every 15 seconds, shrinking average human attention spans down to 8 seconds. Teens spending over 5 hours daily on screen devices double their risk of clinical sleep disruption and anxiety symptoms. Blue light emitted by phone screens suppresses melatonin hormone production by 50%, delaying natural sleep onset by 90 minutes. Setting screen modes to grayscale and enforcing app daily limits reduces compulsive phone checks by 40% within 2 weeks. Transitioning to sugar addiction. Ultra-processed sugary foods stimulate brain pleasure centers stronger than cocaine in laboratory trials. High sugar intake causes blood glucose spikes above 180 mg per deciliter, followed by sudden energy crashes within 60 minutes. Insulin resistance develops when high sugar consumption forces the pancreas to pump out excess insulin continuously. Chronic high sugar consumption increases type 2 diabetes risk by 26% and doubles the risk of fatty liver disease. Replacing sugary sodas with water cuts daily sugar intake by 40 grams, lowering liver fat levels within 30 days. Addiction is a chronic disease of brain reward circuitry, not a failure of personal willpower. Professional medical treatment and support systems empower long-term recovery every day.